Welcome to Medicinario. In this video, we discuss about coronavirus, which is responsible for the widespread pandemic COVID-19. Now, coronavirus is a RNA virus, which means its genomic material is RNA. Considering the morphology of coronavirus, we can say that it's enveloped and it contains crown-like papilloma spike proteins on its outer envelope. Let's draw the diagram of coronavirus. Suppose this is the envelope which contains the crown-like papilloma spike proteins, and which are the crown-like papilloma spike proteins are guarded on either side by certain proteins called as M protein, M as it stands for membrane proteins. Now, the genomic material of coronavirus is an RNA. So inside the envelope, we have certain nucleocapsid proteins which are associated with RNA. So that was about the morphology or the structure. Now, coronaviruses are pretty large viruses. These are 120 to 160 nanometers, and these are spherical in shape. Now, let's discuss the human coronaviruses, which are responsible for coronavirus infections in humans. Number one is the human coronavirus 229E. Secondly, we have the human coronavirus NL63. Thirdly, we have the human coronavirus OC43. Fourthly, we have the human coronavirus HKUI. Then we have the SARS coronavirus or the severe acute respiratory syndrome coronavirus, and MERS coronavirus or Middle Eastern respiratory syndrome coronavirus. Now, SARS coronavirus 2 is responsible for the widespread pandemic COVID-19. Now, human coronavirus, they produce mild upper respiratory tract infections in humans, and sometimes they may also cause mild acute diarrhea. Now we will discuss the transmission of coronavirus. Coronavirus is a highly transmissible disease and very infectious also. So it can be spread by coughing, sneezing, close personal contact with people. Suppose if people are shaking hands and or sharing certain articles, it can also be spread by droplets. So this transmission can be prevented to a large extent by washing hands frequently, using hand sanitizers, and avoiding personal contact. Now we will discuss the lab diagnosis of coronavirus. So we can collect nasal swab, tracheal swab. We can also collect the sputum of patients for testing of coronavirus. Now we can detect coronavirus antigen in the blood with the help of ELISA, enzyme-linked immunosorbent assay. We can detect the antibody against the coronavirus antigen with the help of hemagglutination inhibition test and ELISA also. Now let's discuss the control measures we can utilize to control the coronavirus outbreak. Number one, first of all, we have to isolate the patients who has COVID-19 infection. Secondly, we have to quarantine the exposed people who have come into contact with the infected patients or corona infested people. Thirdly, the most importantly, we have to put travel restrictions so that people don't transmit the virus to another people, due to which several countries have put in lockdown measures. Now, we have to use PPE or personal protective equipment by health workers, which will prevent the transmission of infection from the COVID-19 patients to the doctors, nurses, and other healthcare workers who are working to fight this pandemic. Also, frequent hand washing with soap, water can prevent the transmission to a very large extent. And most importantly, we have to avoid contact with people and perform social distancing. Now, I would like to mention something about the SARS coronavirus, or the severe acute respiratory syndrome coronavirus. It was first recognized in China in 2003, and it spread to 29 countries, and it caused almost like 8,098 cases and 774 deaths across the globe in 29 countries. And no case was reported since 2004. And some of the symptoms of coronavirus SARS infection are muscle pain, headache, sore throat, fever, dyspnea. Dyspnea is difficulty in breathing, or cough, pneumonia, and other respiratory symptoms can be observed. Now let's discuss something about the MERS coronavirus, or the Middle Eastern Respiratory Syndrome coronavirus. Why is it called Middle Eastern Respiratory Syndrome? Because it was first recognized in the Middle East, Saudi Arabia, in 2012. And since then, from 2012 to 2018, it has caused almost 2,143 cases and 750 deaths in 27 countries across the globe. Some of the symptoms of MERS coronavirus are fever, cough, shortness of breath, pneumonia, and even it can cause kidney failure in some people. So that was all about the coronavirus. Please like, share, subscribe, and comment.